This is an urgent question, but I don't get a sense of urgency from the Secretary of State that he wants to actually resolve this dispute. I'm afraid standing at the dispatch box and traducing the junior doctors for their approach to this is not going to help resolve this matter. I would urge him to drop any preconditions on any future meetings, because the only way this can be resolved is through negotiation. Will he do that now?
Well, firstly, Madam, there is absolutely no traducing. My very last answer before his question was praising the junior doctors and recognising the fact that they have faced huge pressure from the pandemic, and that is why we stand ready to work with the junior doctors. I think there is a distinction in terms of some on the junior doctors committee of the BMA who have a different agenda, but we stand ready to work very constructively with the junior doctor community. He then suggests that I drop the precondition. It's not me, Madam Davis. Let's set the precondition. It is the junior doctors committee that set a precondition, and I just remind the House it includes restoration to 2008 of all elements of pay, not just basic pay. It includes things like parking fees and exam fees. It includes, quotes, radical reform of the DDRB. It is the Junior Doctors Committee that set those preconditions, not the government.
Andy Carter.
Thank you very much, Madam Deputy Speaker. Can I commend my right honourable friend for the way that he and his team have worked to find solutions with other trade unions, particularly the nurses. Nonetheless, the 96-hour walkout is a significant period of disruption. Can the Secretary of State confirm he's doing everything he can to ensure that those needing urgent health care in Warrington will be able to access it, despite the industrial action by the BMA?
Well, I thank my honourable friend for that question. And yes, the department is working very closely with colleagues in NHS England and across the NHS to mitigate as best we can the impact of the junior doctors' strike. He's right that we had meaningful and constructive talks with the Staff Council representing the Agenda for Change staff, and that is why I'm very pleased, as a result of the constructive engagement we had, the NHS Staff Council was able to recommend that pay award to their members. And he's right that that points to the constructive approach we have taken. We stand ready to have that constructive engagement with junior doctors, recognising the real pressures that the profession has been under. We will mitigate as best we can, but given the timing over the Easter period, then obviously there is a risk in terms of patient harm, but we will do all we can to mitigate that.
Sarah Olney.
Thank you very much, Madam Deputy Speaker. The latest figures from January 2023 show that 7.21 million people were waiting for NHS treatment. What impact does he think that this strike is going to have on the extremely hard work that's being done across the NHS to reduce these waiting lists? And what plans does he have to address the impact that this is going to have on waiting lists if he doesn't plan to take any action to avoid this strike?
Well, I think we can see what sort of impact it will have from the previous strike, which was over 3 days, and that impacted 108 to 1,049 appointments, to be precise, were impacted. So we can see there is a significant impact. In terms of mitigations, as part of our electives recovery plan, there's a range of issues that we are doing. The expansion of community diagnostic hubs, the fast-tracking of surgical hubs. The NHS is responding brilliantly with things like Super Saturdays, where teams process higher volumes of treatments, particularly in certain areas. We've got the Get It Right First Time, led by Sir Jim Mackey and Professor Tim Briggs, that is looking at how it embeds best practice. And of course, having hit the first interim milestone of our recovery plan in the summer, the 2-year wait, we're now very focused on the 78-week wait target and working our way through that.
Elaine Saxby.
Thank you, Madam Deputy Speaker. The British Medical Association's pay demands are over 4 times the size of the private sector average pay increase. Does my right honourable friend agree that inflation is the enemy, making everyone poorer, and that public sector pay rises of over 25% will only drive inflation even higher?
Well, I do agree with my honourable friend that we need to do both. We need to get inflation down, recognising that has an impact across the whole workforce, including for those working within the NHS itself. But we need to balance that with also recognising the very real pressure that junior doctors and others within the NHS has faced. And that's why we stand ready to have meaningful and constructive talks with junior doctors in exactly the same way as we have with midwives and nurses and others within the Agenda for Change. We've got to strike a balance between the wider issue in terms of inflation and what is affordable to the economy, but also recognising the real pressures that the NHS has faced and how we respond to that, including for junior doctors.
Alex Cunningham.
The Deputy Speaker, the Secretary of State, he can't blame the opposition for his mess, and nearly every day I read tweet ads from the local NHS trust trying desperately to recruit doctors and other staff. Does he actually accept that pay is a key factor in the large number of vacancies within the NHS, and will he do something to sort that out?
Well, I do accept that pay is an important factor in terms of staff recruitment and retention. It's not the only factor. The estate is also important. Technology is also important. There's a range of issues, and that's exactly the conversation that I had with the trade unions representing the Agenda for Change staff. We discussed both changes to pay, but also the non-pay measures that we discussed with them. So I think there's a range of factors. We stand ready to have those discussions with junior doctors, but they have chosen to take a more political, militant stance in contrast to the approach that other trade unions have pursued.
Thank you, Madam Deputy Speaker. I also feel that the Secretary of State's attitude and language from the dispatch box this morning is not very helpful in negotiating with such a key group of people. Now, Madam Deputy Speaker, the BMA accused the Secretary of State of misrepresenting the truth when he tweeted that its pay demand was a precondition. Does he now accept that the BMA have said their 35% demand is a starting point? Will he therefore sit down and negotiate an affordable settlement without delay? And can he clarify which side is correct?
Well, Madam, I've already answered that question twice. I'm very happy, as I say, at the dispatch box to repeat the fact that I have checked, Madam Deputy Speaker, with my officials in the department this morning, with people that were in the room, and I've also checked the minutes, and that was the position that the junior doctors set out in terms of a precondition. And indeed, it's the position they've repeatedly stated in the media, that they expect a 35% pay restoration, but not simply that, but also additional issues as well, such as exam fees, parking fees, reform of the DDBRB, and so forth. And that is a position the junior doctors have set out. But I repeat, we want to work constructively with junior doctors. We recognise that the profession has faced huge pressure in terms of the pandemic, and we stand ready to work constructively with them in the same way that we have done with the GMB, with the RCN, with Unison, and many other trade unions.
Matt Weston.
Thank you, Madam Deputy Speaker. The junior doctors are the backbone of the NHS. Those I've met, I would never describe as militant. They're hard-working, of all ages. Somehow, over the last 13 years, this is the second strike the junior doctors have staged. There were none in the previous 13 years under a Labour government. So will you just explain and confirm, has he not set out his own precondition, and that is that he will not meet with them until they call off the strikes?
Well, I think there's two different things. I mean, one in which is correct and one in which is not. So he's correct in terms of we have said that a precondition of having meaningful and constructive talks is that the trade union suspends strikes, and that is a precondition that the other trade unions were more than willing to enter. That's also a precondition that's applied in other sectors such as education. So we have been clear on that. Where he's not correct is my point in terms of militancy was specifically referencing the junior doctor committee. We stand ready and recognise the very real pressure that many within the junior doctor community have faced. The NHS has been under significant pressure coming out of the pandemic. We recognise that there are issues we want to work with them and recognise and want to have constructive engagement on. It is just regrettable, as indeed they have said in their media interviews, that some within the junior doctors committee of the BMA have said that they want to take a more overt political agenda rather than working with us to focus on the real issues that many junior doctors are concerned about.
Jim Shannon.
Deputy Speaker, I thank the Secretary of State very much. I take the notice that the Secretary of State is trying extremely hard to try and find settlements, and the past settlement with the Royal College of Nursing and the nurses is an example of just doing that. It took a bit of time. I would like to see it happening earlier, but will the Secretary of State outline what support is available for those junior doctors who need greater support from the registers and the consultants to restore confidence, which is the whole point of the F1 and the F2 process, and not left to drown under the pressure of handling entire wards on the worst shift patterns possible and wondering when they go home if any of the decisions that they've made are the wrong ones. Will the Secretary of State ensure that financial and wage negotiations will be constructive, as the Secretary of State did when it came to the RCN and the nurses? Thank you.
Well, I thank the honourable gentleman for his question. I'm very happy to give him reassurance in terms of our desire to have that constructive engagement, exactly as we had with colleagues on the NHS Staff Council. I think there are a number of issues that we're very keen to work with junior doctors to address, and he mentioned the issue of rostering, holidays, which sometimes are cancelled at short notice. There's a whole range of issues that have been raised with me, and indeed, when I go on visits, as I do on a very frequent basis to hospitals, staff raise a range of issues, and I'm very keen to work through those issues with the junior doctors. And I think people can see from the approach that we took, not just with the Agenda for Change, but the changes to pensions that were announced in the budget, that the government is working constructively with the NHS to address these issues, and we stand ready to have exactly that meaningful and constructive engagement with junior doctors.